Hello everyone, and welcome to Ask Dr. Rockove. I'm Dr. Shammai Rockove from the Center for Men's and Women's Urology in Portland, Oregon, responding to a lot of great questions that have been coming in. One in particular that came in this week that I think is infinitely important I want to address. It's a young individual who sent in a message because he saw some blood in his urine and wanted to know if he should worry about it. And the answer is that there are few things that come into our office that we take very, very seriously more than blood in the urine. Bleeding anywhere in the body is never normal, and the urinary system is no different. If one sees blood, then that means that there's an area that's been very irritated and very inflamed. Basically, urine is made in the kidney, and it goes down a tube called the ureter, which is the transport tube from the kidney to get to the bladder. Urine stays in the bladder until we're ready to evacuate, and then we urinate, men through the penis, women through the vaginal urethral area. Anywhere along that path, from the kidney down to the very tip of where the urine comes out, can get irritated and could be a source of bleeding. What things commonly cause bleeding? In young individuals, it can be trauma, it can be infection, it could be stones, it can be kidney disease, and our most worrisome concern, which is not as common in younger people as in older people, but nevertheless is a concern, is potentially things as serious as cancer. Absolutely, absolutely, anybody who sees blood in their urine, even one time, should go in for evaluation. My preference would be to see a urologist because you definitely need to have a thorough evaluation. You have to be evaluated from the kidneys to the very tip of where the urine comes out. Again, if you're younger, most likely it's not a dangerous cause of a problem, but nonetheless, it needs to be evaluated. Never, ever ignore blood in the urine. Certainly, as we get older, that becomes even more worrisome because the older we get, the more concerning it is for cancers to be present. So the younger we are, the less likely there are to be cancers, but nonetheless for there to be real issues developing. The older we are, absolutely. Things that even add to the concern is a history of smoking, because smoking is associated with cancer development within the urinary system, and exposure to some environmental and chemical toxins. Again, the take-home message is never ignore blood in the urine. Preferably go to a urologist for it to be evaluated.